these older men, they or middle-aged men, uh, they need a workup, and should be thinking about getting that data. So that's
Wow.
second. So the second clause is difficulty maintaining erection. Well, that's all men. All men as we get older have difficulty maintaining
Right.
erection. We're just you're 15 years old. You you know you hold a girl's hand for 5 minutes. You get an erection for an hour and a half. But that's not happening at 25 or 30. It's just the way it is. And it's multifactorial. But one of the causes is vascular. As we get older, the smooth muscles around our venules don't constrict as well; they get weaker, and the venules, these small veins that keep blood in the penis, get weaker as well.
Right.
Does that have to do? Sorry for interrupting. With
Yeah.
experience and novelty too. Like when I was a kid, obviously holding a girl's hand was very exciting. Now, I hold a girl's hand
Well,
almost every single day. It's not as
let me
like
draw
the.
let me draw an analogy, Ali, to that.
Mhm.
When you were 12 years old and held a girl's hand, you didn't have a lot of graphic, borderline kinky fantasies of what might happen. But when you're your age or my age, of course you do. So actually maybe we should be draw an analogy. Maybe we should actually be more turned on at our age, or as turned on certainly as we were then. So there are other things that are going on, and one is that it's just simply physiological. We don't have blood in the penis the way we did when we were older, when we were younger rather. And I'll draw an analogy. If I flew to see Saeed in where are you in Riyadh right now? You're in Jeddah. I don't know where he is. Where
Right.
you're at. He's in
Yes.
Saudi Arabia.
Riyadh.
You're, if I flew to see him in Riyadh, and I'm on a plane for like 12, 14 hours, and well, my ankles, my socks, and my rings get tight. That didn't happen when I
Right.
was 25 or 30 years old. And why is that? It's because as we get older, again, we have this weakening the smooth muscle in the veins, and in the ankles or in the fingers. It means that blood is actually some blood or serum actually leaks out into the interstitial space and produces a little bit of swelling.
Oh.
In the penis,
Wow.
it means that blood is leaving the penis. So now, obviously, other things enter into it. When you're 20 years old, you can have sex with a goat. When you're by the time you're 30, you have other things on your mind. So there are mental factors as well too. It could be I'm worried about paying the mortgage, or there's a baby crying in the next room, or my wife and I had a fight this morning, or I'm cheating on her. I feel guilty, or just psychological issues, or maybe the last time we tried to have sex, I failed. Whatever, because these are psychological issues that are part of it, problem as well too. Am I going to fail again? And then there are medications. We doctors prescribe antihypertensives and antidepressants that interfere with the man's sexual performance, women's sexual performance as well too.
Wow.
And that's something discussed with your doctor as well too. I would say probably about a third of the men with whom I discuss erectile dysfunction, they have a medication-related problem. And we doctors have screwed them up because we haven't warned them about about those problems. And then there's alcohol. You maybe shouldn't have that fourth cocktail, Saeed. Ali, I don't know, man. That smoking that entire bong. I mean, you're too old for that kind of thing. Or it could be, Saeed, you can't expect to be up dancing until 2:00 in the morning. It's still just the way it was when you're 20 years old. So they're just, there are other things that enter into it. But with the acute problem, if you're getting hard and you put a ring on it, you keep the blood in. So the PD5 medications, right? Pills, Viagra, Cialis, they put a little more blood in, but they don't keep it there. What I didn't understand 4 years ago was that, hey, Dr. Justin, you're going to be talking about erection rings the rest of your career. Because what the data shows is that the vast majority of men, their problem is not they can't get up, but they struggle to get up. Those guys have serious problems. But the vast majority of men, the problem is they get up and they lose it. And the conventional erection rings you get in a sex toy store on Amazon, these hard silicone rings, they pinch, they're uncomfortable, they can actually be dangerous with men who have compromised circulation. So when I got into this area, I wasn't thinking about how I'm going to solve the erection ring problem. By the way, I'm going to figure out your guys' sexual density with one question right now. Ali, do you use erection rings?